This video is going to cover how to increase mobility at C6-C7 in the lower cervical spine using manual traction. The goal of the treatment is to elongate soft tissues around the structures and increase mobility at the joint itself. So to do this, we're going to increase the range of motion and mobilization through a high load traction technique in order to get separation of joint structures as well as lengthen the surrounding tissues. The reason I'm opting for a manual traction and not some other type of traction such as mechanical is the fact that manual traction gives us the ability to manipulate the neck in a position of flexion in order to target that lower cervical spine. And then also using manual traction gives the PT the kinesthetic sense about what is going on at the joint itself. And in this particular case, that's probably very important because a major caution that we should take when dealing with a hypomobile joint and applying traction to it is the fact that typically when a joint has a decreased range of motion, joints proximal or distal to it have to compensate for that decreased range of motion by increasing their mobility, creating an instance of hypermobility in those joints. And we know that one of our precautions and contraindications to traction is hypermobility, so we have to be very cautious when applying mechanical or manual traction to a hypomobile joint in the cervical spine. Some general precautions and contraindications to consider are if the patient had any type of spinal fusions or suspected fractures. This is a hard no for any type of traction in the cervical spine. If the patient's injury is an acute injury or there is current inflammation, traction does increase the probability of re-injuring that lesion in the spine. Any joint hypermobility or instability, this can come in the form of ligamentous instability or patients who are pregnant, who have rheumatoid arthritis, etc. Patients with uncontrolled hypertension should be ruled out for traction, and then any traction that increases symptoms peripherally. So if traction increases symptoms distally. And then finally, the treatment parameters for the cervical traction. We are going to have the patient in a position of supine with slight neck flexion to about 35 degrees in order to make sure that we are targeting that lower cervical spine. We are going to do intermittent hold times, 15 seconds on, 15 seconds off. As far as the force goes, for the first session, we are going to try about 8 to 10 pounds, and then as we progress, we are going to add 3 to 5 pounds each treatment session in order to get to a point of about 7% of body weight. And then as far as treatment duration goes, the first session we'll do about 5 to 10 minutes, and then progression is as follows. If the symptoms decrease and the patient feels better, we will keep the treatment duration the same. If the symptoms do not change, we will gradually increase the treatment time in order to see if a longer treatment duration will be more beneficial. And if the symptoms get worse, then we are just going to discontinue traction. And then treatment frequency should be around 2 to 3 times per week, and the patient should see signs of improvements within 6 treatment sessions, and if they do not, we should probably discontinue the traction.